Doctors Association for Relief and Education. Their talks. Transforming ideas into reality.
Rahmatullahi wa barakatuh. The topic, when this program was decided and the main theme was finalized, so we were all searching for topics, and the topic I had chosen, I had given a topic. I think one or two words fell out of the sentence somehow, I don't know how, and it was over-dependence of healthcare on technology, which includes investigations and all the things, all the allied things. So the topic is over-dependence of healthcare on technology. So we have right here we are an August gathering over here, and we are groups of people who are, I am sure there are some of us among us who are less than 3 years into practice, those people who are from 3 to probably around 10 years into practice, and there are also the seniors among us who are more than 10 years into practice. I am quite sure none of the seniors over here would disagree with me if I told them, tell a point that the practice for the past 10 to 15 years, there has been a paradigm shift with the inclusion of technology, with the inclusion of various new technologies that have come into the market. So we have seen how the X-ray has evolved into a CT scan, a 16 slice CT, which became a 128 slice CT, which later on came in this market was an MRI, and now we have contrast enhanced MRIs. Then we had in the field of in other fields, like for example in biopsies, we started with hematoxylin and eosin staining, and today we have virtual staining. Then we had the pathologist counting blood cells sitting with a microscope with a formula, counting blood cells in a Neubauer chamber, and today it has become an autoanalyzer that has been done by an autoanalyzer, and the Boyle's apparatus has become a workstation. Grafts have become 3D printed body organs, and the list goes on and on, such that even the surgeon's hand is being replaced by a robot or by some sort of therapies like proton therapies. These are all medical marvels, and we have seen them all in the previous 3 talks. The previous 3 speakers have enlightened us on how far medical technology has progressed. So we know that. In medical technology has progressed, all technologies have progressed. We have an instrument in our pockets, in our bags, sitting called as a cell phone. A very wonderful instrument. We are over here, those people who are in their 40s or around their 40s, we are the only generation probably in history who has witnessed the metamorphosis of technology from telex, from telegrams to cell phones to whatnot, what we are seeing today. So we are probably the generation which has experienced transition where we had those rotating benzil phones where we used to rotate for every one digit, and today we have cell phones where we can tell one lady called Siri, hey Siri, call so and so, and the phone just goes on to that. So we have that. So we have seen that. So what has happened with just giving an analogy with the cell phone technology, which came in the market as an introductory thing. Later on, we became reliant on that. It proved itself to be a very reliable technology, the cell phone. Slowly, we became over-reliant onto it, and finally now we have become dependent on it, haven't we? Now just imagine a day where you put your cell phone in your car and go outside, how uncomfortable you will be without your cell phone. We have all experienced it, and I'm sure there's no one in this room who hasn't experienced this feeling of him having forgotten his phone at home and how uncomfortable he feels throughout the day. That is where the problem arises. That is called as over-dependence on a particular technology. Come back to healthcare. Healthcare, which began with probably 50 years, 100 years ago, where our forefather medical practitioners, they started with basic clinical techniques like what we were taught in our 2nd and 3rd years of our graduation. The 4 techniques: inspection, palpation, percussion. Then came the stethoscope, which added the word auscultation. That's the basic clinical techniques: inspection, palpation, percussion, auscultation. Now these techniques form the foundation of a clinical procedure, of a clinical examination. Now with the progress of time and technology, there has been so much of learning that has been included in the curriculum that the newcomers have started to forget the importance of the four vitals: inspection, palpation, percussion, auscultation. Now we have slowly started depending on medical investigations. Yes, investigations. What has happened? Clinical skills have taken a back seat. Clinical skills. What hepatomegaly, which used to be diagnosed by our forefather clinicians by a simple act of percussion with 2 fingers, has now become dependent on a CT scan or an ultrasonography scan. Anyone to contradict me? When we were taught clinical techniques, cardiomegaly, hepatomegaly, all these were taught just on the sound, with the note of a percussion which is produced by 2 fingers hitting each other at the knuckles. But today we cannot do that. We need an ultrasonography scan, or at least, or a CT scan, or some sort of a scan to identify a hepato or a cardiomegaly. We have come to that state. That is what I wish to. Now what happens in these things is, the training and this clinical skills, as we progress, we become more dependent on technology. Now that is where things go wrong. That is where things go wrong. Once you know the clinical examination, once you are good at your clinical examination, all the investigations or the technology supported diagnosis come at a later stage. The clinical examination is paramount. Now when the doctors, the generations of doctors that are being produced over the period of time, as technology advances, unfortunately the dependence on investigations is increasing. The dependence on what your eye sees and your ear hears is being reduced, and that is definitely causing some problems, particularly in the quality of life of patients, our patients, obviously, because they will be hurt. There was an adage which I remember, which is the qualities of a surgeon would be: he has an eagle's eye, a lion's heart, and a lady's finger. I think we are losing these qualities, because we are losing our eagle's eye to depending on investigations. We are losing our lion's heart as we are depending on scientific protocols and not our experience. Scientific protocols which are proposed by some other people of some other ethnic race, like a Western race, and we are trying to depend on what their experience is rather than depending on our local experiences. And obviously the lady's finger now, having seen such beautiful technologies like the Da Vinci system, I am getting scared. I am actually getting scared. Anyway, that's on a lighter note. Okay, so this is what is happening. Now another thing which has happened in medical technology is, we have become dependent on something called as our colleague Dr. Google. Our patients are also dependent on it. He is misguiding our patients, and he is definitely not guiding us in the proper way. Dr. Google, what has happened? See, as the search engine technology, I will give you a simple anecdotal example. I am sure people who in this room have, I am just going to relate a small incident, common happening. Every year we celebrate Bakrid, don't we? There are a good number of us as people, just before the animal is sacrificed, we pull out our phones and we check Qurbani ki dua kya hai. Correct? We check. And we immediately, phone nikalo, we take our phone out, Qurbani ki dua kya hai, jaldi phone mein dekho, Qurani dua uthao, chalo, Bismillah, Allahu Akbar, come on, do your work off. What happens if your phone falls in the bucket of water, or probably the goat swallows your phone? What happens? What has the phone created? It has created dependence. What kind of a dependence? A decreased willingness and a decreased motivation to learn and memorize a particular point. Correct? Apply the analogy to our practice. Haven't we referred, instead of updating our pharmacology language, haven't we made a quick reference to our phone as to what this drug is when we don't know a particular drug? This is the way which our dependence on technology. Yes, the phone is definitely a useful tool. Yes, but then there has to be kept some limitations in this regard, and we have to be keeping ourselves the willingness to learn the willingness and the fire and the zeal to learn has to be updated, and the fire has to be rekindled every now and then. Okay, this is another issue which Google happens. There are some people who have this habit. If I ask something, where is the nearest HP petrol pump? Where is it? It's just right at the corner. But some people have that habit of saying, HP petrol, there are so many petrol pumps in this area, petrol is a very good fuel, petrol is less polluting than diesel, this and that, they'll tell me so many things. And at the end of listening half an hour of lecture, then they will tell me petrol pump is at the corner. Correct? Relate this to what Google does. You type one keyword in Google, it will give you so much of information, which is definitely beyond human comprehension and retention capacity. When you start reading a book or searching for it, the rate at which you are getting information is controlled by your mind and your will and your capability of absorbing the information. But when you just ask Google 1 second, and that guy, Google, he is so irritated, he's such a show off. Search results in 0.01 second. Thank you, you've done something great. What can I do with all that information? I cannot analyze it, I cannot read it completely, I cannot understand it completely. I'll search, I'll get 10 useless points, and after maybe 10 useless points, 10 useless pieces of information, I will be getting one piece of useful information. Isn't it flooding our, I'm not saying it's bad, but isn't it flooding our minds to an extent that we are not able to assimilate and comprehend what we have read? We experienced it. I hope you have all experienced and you are getting what I am trying to. So what is happening, and with this, and the next thing, when we are depending on technology, what has happened? Sir has just now given one very nice statement regarding artificial intelligence, training the machines. But the thing is, never let the man do the machine's work. Have you understood? Never allow the man to do the machine's work. The machine's work is to work. A work in one particular form, but a man's job is to think. So we have seen n number of situations in clinical practice where the treatment plan is being generated by a computer, by a software. Why? The treatment plan is to be generated by the human mind. The application is to be done, probably the application of those other things are to be done by a machine, but the human brain is paramount, and that is what we have to keep in mind. All right. Now, the last problem which we have is over surplus of technology and information over here is the reduced. Now, this is something which is unsaid and untaught, but is definitely noticed at a subconscious level to everyone. That we have access to so much of information. Is reducing our ability to take bold decisions. Surgeons particularly, I think you would have experienced it. You open your textbook, you open your article, you open your journal, you open your scientific publication, it gives a protocol. If you do not follow the protocol, this is the protocol to be followed. Now the surgeon at the clinical on ground zero level, standing in front of the patient, is forced with the dilemma of whether to strictly follow the protocol or use his judgment, break a few protocols and work on save the life of the patient, and do the procedure of the patient in a proper way. I don't mean to do something heroic, but there are some times when some rules can be broken. All surgeons probably know this experience, they would have seen this, they would have experienced it, and I'm sure nobody would disagree with me, where you have to know the rules and the protocols and to what extent they can be broken. Because remember, science is something created by man. It is not a scripture. The books written of science have been written by human beings who are very much like you and me. And we all have the tendencies to make error. And that is why they are revised every 1 or 2 years. Me being from the dental profession, for example, there was a time when people used to dread a piece of a tooth being left inside the jaw. You try to extract a tooth, something breaks and the root is left. The previous thing what we used to do is dig and somehow cause a lot of trauma and get that root piece out, and it is like a prize that I have got a root piece out, I have found gold. What now? Recently, the American Dental Association has issued a guideline, or they have published a new technique called as partial, fancy word, partial odontectomy, where you remove one part of the tooth and leave the root inside. When I came across that article, I read that article, I was left to laugh, and I was thinking, अरे ये चामीनार वाले तो ज़माने से कर रहे हैं, by removing half a tooth. So then I thought, okay, fine, Charminar is more advanced than USA. So these are things happen. So what happen by that? What I mean to say is we tend to develop a less reliance on our common sense. Common sense becomes uncommon. There are two things, as I proceed towards end, there are two things which we have to keep in mind. One is the element of knowledge, the other is the element of wisdom. Knowledge is what we are sitting in a house of knowledge. A man who has read so many books. We are all a postgraduates over here. Just collect the books of what you have read during your post-graduation. I am sure it would fill a room. I am sure it would fill a room. Because as I know, probably because as I know, as a dental postgraduate, we had 38 to 40 books to read to become a postgraduate, to face the postgraduate examination. And I am sure it is not less in any specialty as such. In any medical specialty, I don't think it's anything less than 40 books of at least this thickness to become a postgraduate in a particular field. That is knowledge. Knowledge is, yes, gained through books. Yes. On the other hand, there is wisdom. Wisdom is something which is learned from fellow human beings. When the knowledge was being given to mankind, knowledge of our holy book, the supreme knowledge what we have, that is the holy book of the Quran. When it was being given, the first line that was revealed to our holy prophet was Iqra bismi rabbika alladhi khalaq khalaqal insana Iqra wa rabbuka alladhi allama bil qalam allama al insana ma lam ya'lam. Read. The first word was read. The order given to mankind is read and use a pen which you transfer knowledge from one person to another person. But there is one thing more to think and ponder over it. If it was only to be read, a question which is to be asked and a point to think over it. If the book was only to be read and learned, and knowledge could be learned just like that, was God weak enough not to send a book directly to mankind? Why? God could have directly sent the book directly through his angels, or directly he could have sent the book and you sit and read the book, that's enough. Nahi. Allah Ta'ala ne waisa nahi kiya. What did Allah Ta'ala do? He sent a teacher. He gave the book to a teacher to teach it to mankind, and our teacher is Prophet Muhammad Sallallahu Alaihi Wasallam. Have we understood this? Now the teacher, what he taught us is the wisdom. What we learn from our teachers is wisdom. It is the cumulative his experiences being shared with us and transferred to us, and that is how wisdom is learned. Knowledge can be taken from books, but wisdom cannot be taken from books. And that is the problem which is happening in today's generation. People are well read, people are well educated, but unfortunately they lack the ability to talk to the patient. They lack the basic common sense and the basic skills to know how to handle a particular patient. At the clinical level, and probably even at every other level, this is the problem which is rampant in our society. Anybody would disagree with me? We lack that. Okay. So that is what. So the Quran itself, as I said, our religion is the complete religion. So we have to learn from every aspect of our religion and try to derive the moral lessons what we have achieved and apply it in our daily life. That is why it is a universal book. That is why they say our religion is a universal religion. Okay. In this context, there is a saying. There are three phases in the life of practitioner, surgeon, doctor, whatever. The first phase, he learns what to operate or what to intervene, where he gains knowledge. The second phase, he learns how to operate or how to intervene, which is partially knowledge and partial wisdom. And when he gains the wisdom, he learns the last phase, the final stage of enlightenment. He learns what not to operate, which patient not to touch, which patient to just say, go, I am not going to intervene in your case. And that is a very bold thing, because many a times if you use common sense, the best thing to do for a patient is to do nothing. There are many instances in medical science while treating patients where the best thing to do, for example, we have undisplaced fracture, just advise the patient of an immobile bone, just advise some rest to the patient. You don't have to intervene. There are many situations in many particular anatomic areas. I don't mean to give a blanket statement, but there are some areas, like for example in my region, there are some fractures which do not need any intervention, but still we see a lot of them being intervened in private hospitals for reasons, for whatever sinister reasons we do not know. But if the fracture was left as it is and the patient was just given a little bit of rest and a soft diet, the fracture would have healed up on its own. Yes, we have a good number of examples in my field, and I am sure such examples would be existent in every branch of medical sciences that exists today. Okay, so now that would be about that. Now last thing, the biggest setback, and this is where we, as this podium being Dare Talks, this is our podium, where I can openly talk about my religion, and I know the people who are listening are also going to believe in what I am going to talk about. Now the biggest problem of technology we have today is the risk to our iman, the risk it is causing to our iman. The same way the mobile phone, the cell phone being a very good instrument is eating into our time, is causing us to, is leading people astray, as well as leading people on the right path, as well as leading people astray. The same thing is happening with us in this region. Just a simple example, the water cycle. When a child is being taught about the water cycle, we are teaching our child, this is water, it evaporates, it goes up, it condenses into cloud, dushum, the cloud becomes heavy and falls on the ground. This is the water cycle. We are forgetting to teach our children that the water is being sent from the skies by the will of Allah. The water cycle is happening by the will of Allah. That point is being missed out in our education. That the water is being evaporated and it is being condensed and it is falling at a specified location. Who is mediating it? It is being mediated. The system is being mediated by our Creator, and that is the point our incoming generations are beginning to miss out in our educational system. Now that is what applies to us also. That applies to us. That is where we are reading, we are having knowledge. Tell me one thing. How many of us have attended conferences where we have attended super boring lectures of people talking about so much of knowledge, which at the end of the lecture we have not been able to understand one word of? We have all attended such conferences, but what if but the other thing, there are people who, the speaking, because this is what I wish to emphasize over here is the person's skill of communication. What I wish to emphasize is the person's skill of communication. That is, we as doctors, in this age, I am not talking about you and me, I am talking about a group of us as a group. The collective capabilities as a group, our communication skills are dying down. We are well learned, we are well educated, we have the highest degree to our credit, but unfortunately there are people among us who are not able to communicate to a patient the way a patient should be communicated to. And these are soft skills which are not taught in college. Unfortunately, they are not taught in college. Tell me which medical college, which dental college, which academy or institution of healthcare teaches its pupils how to talk to a patient. How to talk to. Now, if a male doctor wants to talk to a female patient, or a female doctor wants to talk to a male patient regarding some personal issues, what are the mannerisms that the doctor should adopt? What are the mannerisms? What is the manner? What is the method? How you are going to approach your patient, and you are going to ask and make sure the patient is going to answer your questions with comfort. It's a skill. Yes, I see a lot of dental graduates. We have day to day dental fresh graduates. If I tell the junior, did you ask about the woman's menstrual history? Sir, मैं कैसा पूछूं sir? That is where communication skills lie. The professional, medical professional has to have that knack where he is able to communicate with the patient in such a way that the patient does not feel self-conscious and he is able to get the required medical information out without patient feeling conscious. So, okay, now that is one part. Now the other thing is, when we are coming to communication, what is happening? Our community, I don't refer to you and me, I am talking to our community as medical professionals, irrespective of, in fact, probably irrespective of religion also. With our reliance on these man-made books, we have begun to forget our limits. We have started giving guarantees to our patient. We have started giving guarantees to our patient. हाँ, guarantee आपका treatment हो जाएगा, हाँ, ये आपका कम हो जाएगा. How many of us have the guts to discuss कि ये treatment हो सकता या हो नहीं सकता? There are few, yes, particularly for the risk of high risk medical consents. For them, they do talk it out. But those procedures with low risk, how many of us are the bold enough to, low risk procedures, like how many of us have the boldness to say that this procedure has got its own limits, I am going to do my work, the remaining is going, it's up to your destiny which has been written by God. So that part has to come. That is our iman. That is where technology should be supported, should supplement and support your iman. As medical professionals, we are the people who know, who have seen it probably with our eyes during our education or during our practice of how a simple spermatozoon ends up as an adult human being. And that is what every time in the Quran Allah Ta'ala mentions and reminds the human being that you were a piece of fluid which was supposed to be discarded, and you have been created into the best creation of God. अशरफुल मखलूक़ात आप बने हैं, तो किससे बने हैं? एक ख़तरे से बने हैं. एक नहीं, दो नहीं, कितने जगह कुरान में लिखा हुआ है ये बात, कितनी जगह ये लिखी हुई है बात. तो as a medical professional, who can understand this thing better? Who can understand this? A small thing which becomes a small cell, one cell becomes 2 cells, becomes 8 cells, 10 cells, this thing, that thing, then becomes then there from somewhere a heart comes, from somewhere a kidney comes, from somewhere a brain comes, this becomes a spinal cord. From where? Who understands that better than you and me? Who can understand that? But at the same time, this is what we have to be careful, because our reliance on technology technology has advanced so much that this may cause what is happening today. The phrase Allahu Shafi is becoming, in essence, it is becoming like, probably amoxicillin Shafi or clarithromycin Shafi. We have stopped relying on the entity which gives us the shifa, and we have started relying on an entity which has been created by man, which has its own limitations. This is happening. Hamara iman, many of our people, we are going weak in our iman and our belief when we come to this place. We have to get this thing cleared out. So, and as I said, these things, there is no better place. I was actually discussing with a friend of mine the other day, and we had come to a point. There is no better place to see the will of Allah better than an ICU. Better than an ICU. The ICU is one room in the hospital which is the epitome of technology what we have. It is an epitome. According to the books, according to pharmacology, according to physiology, we have such drugs and such instruments in the ICU which can restart a heart which has stopped. We have those injections, one direct intracardiac injection of some adrenaline, the heart starts pumping. We have those defibrillators. That is all epitomes of technology. We have that. In theory, we are reviving a dead man. But how many of us intensivists over here have experienced the fact that no matter at times what we do to revive the patient just says, "Mera waqt aa gaya, main ja raha hu." And that is where that is the point which should be numbing and humbling us, that we are ek choti si makhluk hain, and we are dependent on our creator who is far, far, far more powerful than us. And that is where our iman lies. That is where our iman lies. And there is no better place to feel this than an ICU, where we have critical patients. where we have critical patients walking out the next day, and seemingly okay, seemingly normal patients or seemingly mildly ill patients dying the next day. Hope anyone to contradict in this regard? So that's it. This is what I would have to say about this. And before I end, towards the end, I would like to conclude with an ayah from Surah Al-Baqarah, which is given in a slightly different context, a passage from Surah Al-Baqarah, which is of a slightly different context, but it is applicable to us today. The context is when Allah Ta'ala created Adam alayhi salam. He created his creation and told the prophets that I have created this thing. Told the angels, I told the angels that I have created this creation of mine, and I call this creation man. I call this creation mankind. And this first person will be named Adam. All right? The angels looked and said, okay, but this person is going to do this and that. He is going to kill and create a lot of havoc on the planet, on earth. All these things are going to happen. So then Allah Ta'ala proved his point. And he asked Prophet Adam alayhi salam to tell these angels what I told you, what knowledge I have given you. What knowledge I have given you. And then Adam alayhi salam tells all the angels about this thing, about that thing. He tells the names of so many things. He tells about whatever has been taught to him. And the angels stand in awe. What does this mean? What all technological advances, for example, what we have seen in the previous lectures, were impossible to be done by angels. Allah Ta'ala has sent us as a Khalifa on this planet. It is impossible that the angels would have done it. It has been declared in the Quran. This is not what I want to say. It has been declared in the Quran. And the angels said one line. The angels said one line, which I would like to quote before I conclude. قالوا سبحان بسم الله الرحمن الرحيم قالوا سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم. They said, exalted are you. We have no knowledge except that which you have taught us. Indeed, it is you who is the knowing and the wise. And this line applies to us. When we rely on investigations, when we feel that, okay, we know the diagnosis, but I must say, we should also قالوا سبحانك لا علم لنا إلا ما علمتنا. ये सब इन्वेस्टिगेशन है, बट ये सब जितना भी इल्म है अल्लाह, आप जितना दिए उतना ही इल्म है मेरे पास, उसके अलावा मेरे पास कुछ नहीं है. With this I conclude. Thank you so much everyone. Thank you so much for your attention.